This is a important initiative, an important forum today and tomorrow, where tomorrow we'll be focusing on children, to really examine how we're doing it, what we need to do better, how we can collaborate better, and in the end, provide the necessary services for those who need it the most.
Crisis care is something that requires an integrated and a holistic system at a county or a regional level. And in order to get to that place, the forces have to be aligned to make that a priority. We tend to focus on what might we get done in the next, I don't know, like 6 months or a year. This is a long-term, multi-year process that if you were starting from scratch to build a system of care for people with serious brain disorders, you would start by building a crisis system. It is the most fundamental sort of underpinning. So crisis requires an infrastructure that's got to be invested in at the community level. And we're just in the process now of scattering dollars even further to this plan, to that plan, to this provider, to that provider, thereby sort of, in a sense, weakening the opportunity for a common shared investment in a common infrastructure. Crisis services are so integral. It's what you need when you're at your worst or you need help the worst. So, 44,000 Americans dying alone in desperation from suicide, 1,700 in New York, 20% of them in mental health care in our public system. Best of all possible worlds is if the hotline crisis call center is in the same organization at the same place that can deploy mobile crisis. So the fact that you've come together is a great and awesome thing. So good luck. Thanks.
Right? Most times when people think about crisis, especially about behavioral health crisis, they're thinking about someone being homicidal or suicidal, having a plan, and something needs to happen right now, right? But the federal government doesn't define crisis that way, and most human beings don't define crisis in their lives that way. You've got to start to open up your mind about what crisis really is for a child and a family in your system. Because what we've learned is that peer support is one of the #1 things that can de-escalate any crisis. So what we've done in Georgia is made sure that no matter where you are in the state, you can access a crisis system. We have what's called care management entities. And what they do whenever someone is in crisis, they immediately get involved to ensure that the transition to and from the hospital is very successful. Maryland has a system where they also have a crisis and referral service, but it's through their ASL. They have a behavioral health carve-out where all things behavioral health are through this one entity. All of it fits together. Your community system, your crisis system, because really your crisis system is your community system because it's all part of the same thing, right? So it all fits together. Your values, your system, the children, the families, what you guys do, it all fits together. But you guys got to make sure that the puzzle pieces fit for your community.
All of us have different levels of tolerance when it comes to what we can deal with as far as crisis goes. I'm going to read you a series of scenarios which is going to amp up. Who stayed in the game?
We have a responsibility to make sure that the home environment is still functional and stable.
But in some areas, EMS or fire are the first on scene because they're part-time police.
So it should never be a barrier that an agency should say, I can't do this because I can't get paid.
You know what he's going to do, and he's going to know what you're going to do. That's where the communication level has to be.
It got to the point where they felt they didn't have the clinical person within the school.
At our table, is we're really a microcosm of our system of care.
We expect to be brought in, and we hope that we could be part of the team first to de-escalate as well as to assess.
So since we tend to, in the adult system, we tend to default to 911 as our save-all, they shouldn't be our everything. We shouldn't depend on them to always be our psychiatrists and substance use counselors and everything else. They have their role, and community needs to know actually what their role is.
And this is the combination or culmination of our 2 PPSs and actually Refuah, which is another PPS, working together to develop models of crisis services. So what we want to do is help be a catalyst, an innovator, help with the transformation, do some seed funding where possible so that we can really move this system along.
So what we did some time-limited groups in the fall, looked at each of these areas to make sure we had a common definition. We did some graphics and visuals so people could see what the workflows were in and out of these services and how it fit with the larger system. And what we hope to do with this document and working with people is to be able to give communities a place of reference for having sessions like we are today.
I think that the diversity in the room and the passion and the energy and caring about our patients that happens here, this is what's going to help us make the changes that are going to really improve the care for our patients.